Hello, how are you? So welcome to everybody and thanks for Neurotherapy to invite me to give you this webinars, and I hope we can share more time in December when I'm there in India. Well, I want to introduce you in the world of fascia. Fascia is very important for me. I discovered it about 8 years ago, where I was introducing this matter. In the beginning, I thought it's not so important, maybe like you right now. But since then, I'm a fanatic of fascia system, and I will try to make you understand the passion as I do it. Well, any kind of treatment, first we need a good diagnostic. If we don't have a good diagnostic and we don't know where the pathology comes from and all the things which can increase the pathology of our patient, we are lost and we are not able to make a good assessment, good treatment. So the assessment, the diagnostic is fundamental. And since now, I think that we have focused on tissues which are important, but not the most important to know exactly where to start, which pathways we have to go on, and exactly what to do and in which order. And fascia can be the key which allows you to open the body and see what happens and to take the right decision in how to treat your patient. So since now, uh, obviously, when your patient comes, they can have different injuries mechanisms. They can have a traumatic one, they can have a mechanical one, they can have a biochemical one. Obviously, when you have a trauma, you're riding on your bike and you have an accident and you fall down and you break your arm or what else, it's quite clear what is your pathology. You have a broken arm, imagine. But there can be many other things, mechanical overloads that you have before that can increase the pathology of your broken arm. And also you can have biochemical problems which increase the mechanical ones and the traumatic ones. So which system is more important or which has the biggest influence in the healing of your arm? This is also something that we have to find out, and where fascia can be very helpful to know exactly all the things which can increase the pathology of your patient, because there are patients they heal very fast and other patients they need a lot of time to healing. So to know exactly the problem is more a mechanical one, is more a biochemical one, it's just the injury that he has at this moment or something else that we have to find out to discriminate and to find the balance where we have to focus our treatments. So since now, we have the most knowledge about the musculoskeletal system, the blood system, the nerve system. This is what we normally study and analyze in our patients more. And obviously the musculoskeletal system can work well if there's not good nutrition, if there's not removing of the metabolic waste, everything there inside the tissues. So the blood system is very important, we understand this. The nerve system is also very important, because if the brain can send the information to the muscle to contract or to release, the muscle don't work well, and then also can have problems as well if there are nutritional problems. But to understand how important fascia is, first of all, we have to understand that fascia wraps everything in the body, interconnect everything in the body, and everywhere in the body is fascia, connective tissue. So when we are making an assessment, when we are treating our patient, we can remove the fascia system and say, oh, no, I'm going to look only on the musculoskeletal one. Or no, I'm only going to look on the nerve system. It's impossible. As soon as we touch our patient, we are treating or manipulating the connective tissue. And if we really don't know what we are doing, we can make a lot of things wrong. So fascia has to be taken care in our assessments when we are looking for what is the problem of our patients. Normally what we do is find out the background of our patient, how much time is he working, he does sport or not, what is he eating, signs when he has the pathology, what he thinks cause the pathology, all the background that he can support us, also other diagnostic, RIX-A or what else. All this we check it, then maybe we try to find out the mobility which is affected in the area where the patient feels this pain, and then we make in palpation or analyze all the tissue around where is the problem of our patient. For me, this is a little bit wrong, because the body is not a summary of loose parts of or a lot of parts, a shoulder, a neck, spine, and elbow, and what else. No, the body is all. We are all interconnected, all is together. So when we make an assessment, the first thing that we have to think about is that every part of the body can have an influence of the part where the pathology. So we have to analyze everything. And the real tissue which can help us in this is the fascial system, because the fascial system is very clear that it interconnects and is an interrelationship between all the other systems and all the other tissues. So fascia could help us a lot to understand the biomechanical reason which can support the pathology of our patients. So the normal use, or all the other matters or systems that we have analyzed, blood system, nerve systems, all they are necessary to understand. We have to know the anatomy, physiology of all the other tissues, but we also need to understand the fascial system, because, as I said, it interconnects everything, it wraps everything, and each fiber, each nerve, everything is surrounded, wrapped, and interconnected with fascial system. So to understand how it works and why fascia is so important, and which kind of fascia is very important to use in diagnostic, let's make us these questions. So when we are moving, we are changing our position, we are deforming our body inside and outside. But the most obvious deformation in the body is in the outside. Anything that you bend or what else is deforming more in the outside than in the inside. So the maximum tension or compression will be in the outside. So if I bend something like that in the superficial, in the upper part, there will be an increasing of tension, and in the lower part there will be a compression. And the same in the body, and this will be happen just in the surface, because as soon we go a little bit in, the tension is a bit less, then it comes to a point with a neutral point, and then starts a little bit of compression, more compression, and the maximum compression just on the other side. So the maximum of deformation of our body takes part in the superficial. In skin and superficial fascia is about 1 centimeter. And this is very important, because there is where the maximum or where the first deformation starts. So if this is like this, and it's accepted that fascia, and especially superficial fascia and skin, was the proprioceptive organ as well, or the maximum or the highest proprioceptive organ in the body, we understand why the body has put 80% of all nerve receptors in the superficial, and skin and superficial fascia. So 80% of all nerve receptors are in the superficial. Why are they there? Because there's exactly where the deformation takes part, or where it occurs, and obviously also inside, but as I explained, from the superficial to the opposite part, it changed from high tension, lower tension, compression, high compression. So it's much more easier for the brain to understand the changes, taking the information from the surface. And this is why 80% of all nerve receptors are in the superficial. So if this has to take place like this, it makes sense that skin is not elastic. Many people, when I ask them how much elasticity has the skin, they talk about 50, 60, 20. Everybody says something, but all the answers they ever give is too high. Skin is not elastic. It has only 0.7 elasticity. So it means like nothing. So you say, oh no, look, when I touch this, look how much I can move my skin. Yeah, you're moving, you're not stretching. If you want to stretch the skin, try to make a fold like this, and then with 2 fingers try to separate it. And you will see nothing change. You can't stretch the skin anywhere on your body. So skin is not elastic. And why is it not elastic? Because it don't make sense that it's not elastic. So because skin is like a suit that we have on, we have to move ourselves. And if we have a suit on which is not elastic, we can move. So it doesn't make sense that we have a suit on like this. But it makes sense that the skin is stiff or not elastic to transmit all the tension and the compression. So as stiffer or less elastic is the skin, as earlier comes the tension, and as earlier all the nerve receptors are excitated. So imagine that I give you a bungee, a very long one, and I just make a small movement with my fingers like that. So maybe the bungee absorbs this tension and you don't feel nothing in your hand. But if I give you a steel cable and I just make a gentle tension, you feel it immediately. So as stiffer or less elastic a tissue is, as much more it transmits all the tension. So this is why skin is not elastic. And how does the tissue or the skin manage to be not elastic and allows us the movement? This is just the picture that you can see in the upper side. It is body with all these quadrants on. The skin and the superficial fascia are glued with these black lines to the lower parts of fascia, allowing each part of these quadrants to slide a little bit in all the direction, especially in the direction where it's necessary, because skin and fascia are adapted to the movement. And as much more movement you make in one direction, as much more mobile this quadrant is in this direction. So this quadrant allows to the skin to slide on the same time when it's not elastic. This is very important to understand. And also, the superficial obviously is connected to the lower parts of fascia and to all the other structures inside the body. So everything inside the body which reduces its mobility can hold the superficial and reduce the mobility of the superficial. So if the mobility is reduced and the sliding of the superficial of these quadrants are reduced where all the nerve receptors are, we have a change of movement, an increase or release of tension, and a higher or lower activation of the nerve receptors. And this means proprioception has a delay of information which has an aspect or an influence directly in the brain, because the brain gets the wrong information, gives the wrong orders to the muscle, contract or hold a position, and this with the time gives an overload, and this overload can produce a pathology. So even if we know exactly what happens, because someone hit us in the head or in the shoulder, we have a lot of pain there, maybe the tension of the muscles, because they are not working well, because the wrong information, can increase the suffering of this area by a biomechanical way. So to analyze the whole body, the whole proprioception, which is important to understand or to maintain the right muscle contraction and the right posture, is very important. So in the body, nothing happens without information. The muscle is not contracted or relaxed because it wants. It's the brain that says to this muscle, hey, be contracted or be relaxed. And the brain gets the information from the proprioceptive organ, which we thought before that it's more in the capsules and the ligaments and the muscles. But now we have found out it's in the superficial, and then all the other one, the capsule, the ligaments and the tendons and the muscle spindles, give the feedback of what happens. So I'm moving, my sensor gets activated by the tension, the information gets to my brain sends information to the muscle, and then the ligaments, the tendons, and all the other receptors inside the body says, okay, I have received the information. The muscle is just doing what you have explained, that you want to contract 50%. And then the muscle spindle and the ligaments and the tendons say, okay, it's just 50% which is contracted, okay? Okay, everything is fine. So outside gives the information, the brain gives the order to the muscles, and the receptors inside confirm that what happens is in the right way. So is as we have to imagine that everything works in the body. And if there's something that is not sliding well in the superficial, then we have a problem. So the reducing of sliding or right movement of the skin has a direct influence of the proprioception system, which is the government of the movement and the posture in the body. This is very important that we have to understand to know how much important is the fascia system. So how slides the skin, or to understand it a little bit more, we have just this PowerPoint here. We will see the yellow and blue one is just on the thoracic area or on flat areas on the body. And we have to imagine that it's like a gelatin. No? We have it above, the green one. And gelatin, you know, they are very fine when you eat them. But if you shake them, they move like this. The same, imagine that the same does the quadrants on the body. So the superficie is connected by lines which are more adherated or more glued on the deeper layers, but not in the center, just around, not in the middle. And this allowed it to be like a gelatin and to move to all directions. So this allows the skin to slide. But imagine that you don't have quadrants, that everything is just one suit on and it can slide in everywhere. Well, then the gravity will hang it down. So you will have something like that. No. Instead to have firm, or everything will hang in because the gravity will fold everything down. And this is imagined there on the river, which you can see beside the gelatin. The quadrants hold all the skin in the position, allowing that it's not falling down. While with age, something falls down, but normally not so much. But allows the movement of each quadrant to allow to slide in each direction and give the tissue, even that the skin is not elastic. So on the part where we are volved, like the pectoral, we are like this. And when we contract or lift up the arm, it goes flat. And when it goes flat, it separates the borders, giving more superficial. So the deformation of the superficial also allow to give more tissue to allow more complex or more higher movements. And also the Achilla, when we take down the arm, it folds inside and can defold it. So even that the skin is not elastic, it has found the way to allow to be very unelastic to transmit the tension, but on the same time very mobile to allow all the movements of our body. And also in sport clothes, we can see it. The specific one, the high quality sport wears for competition are not only one piece of tissue, there are a mix of different intensities, stiffness to hold everything, but to allow on the same time the movement of the athlete. So imagine that we really have a suit on, which is like a sport wear, which compress us, which hold our position and everything inside, full of sensors to be activated and know exactly what we are doing, how we are moving, and on the same time very mobile but unelastic because we need the transmission of tension. Another thing that we have to consider it in the PowerPoint before was the man who's under the one who has the quadrants. You see they have a lot of lines. These are skin tension lines. Skin tension lines, as the name says, there are lines on the skin which have more tension than in other areas, and they have tension lines in one specific way, not everywhere you want. So why are these skin tension lines there? The doctors need to know these lines to know how to cut the skin to don't make scares, because if you have something which is pulling from right to left and you cut it in the middle, it will separate. So if you have a scare, it separates, and then to glue together will be difficult. But if you have something like that and you cut it like horizontal, the tension will press it together and you have a very nice scare. So the doctors use these lines to cut the skin in the best way. But I don't think that, I don't know who put these lines there just to scare the doctors to learn how they have to cut. there have to be a reason, a mechanical reason. And if you see, the lines on the trunk are horizontal, and in the upper and lower limbs they are horizontal and vertical. So it's just in the direction of the movement. So in the trunk, normally we are making rotation the whole day. Hey, give me this. Oh, how are you? And walking, we're also making this rotation of the trunk. So the lines get more excitated with rotation movement and less with flexor extension, which is a movement that we do normally less than rotation. And in the upper and lower limbs, we do flexor extension. So it makes sense they are longitudinal to the line where we are moving. So it's a specializing of the skin to be more effective in transmitting the tension and to activate all the sensors. So there are many, many reasons to understand why the skin is so specialized in feeling what happened in the superficial and why it's so important for our proprioception, for our posture, and for our movement. So skin, or these quadrants of the skin, have specific movements or slidings methodologies which are not anarchical. They are just depending how you're moving, the skin has to slide in one or other direction. So imagine you are a footballer, you make a kick, so on the lower or on your back, the skin is sliding down to your knee. And in the front side, it's sliding up. And when you're running and your leg is behind you, the skin goes on the front side, it goes to your knee, and in the back side, it comes up to your spine. And when you're crossing your legs, one side goes in one direction, the other one gets in another one. And there are asymmetries in movement of the sliding of the skin. And as I mentioned it before, skin adapts to the movement. As much more often we do a specific movement in one direction, this quadrant specializes in taking or allowing this movement and maybe restrict other ones which he don't need. So if you are sitting a long time in one specific position, or you're repeating one specific movement only in one direction, with the time, the tension of these quadrants will change because they are adapted specifically in one direction, not another one, and then comes in an asymmetry of tension in the body, an asymmetry of stimulation of the nerve receptors, and then an alteration of the posture. Well, this is too much, but you see a lot of people, they are not straight, they are in strange position, and this is not why their brain is not functioning well. No, it's just information that they get. When they close their eyes, they say, no, I'm straight, and they're like in this position. So the proprioception take care of the muscle tone, and this is very important. If we don't change the information that get the muscle, we can try to relax the muscle, but maybe it's only for a few times, then it comes back. So how we can find out where are the problems in our body, where are the asymmetries of tension, where are the dysfunction of our proprioception system. So I explained it that the skin has to slide specifically in different directions depending on the movement of our patients. So why we don't take the movement of our patient and his magic finger? We don't know that the patient has a magic finger, which one he can indicate it where he feels the tension. So if we make a movement and side bending of our neck, maybe you feel some tension here and less here. So if you do the same movement while you have a restriction or a higher tension here than here, maybe you have the same one, then everything is okay. But as I told, the asymmetries in tension is what change the biomechanical or the good biomechanical in the body. So your body has to be symmetry in tension. And this is the matter what we have to find out, where are the asymmetries. And this is why we are using the movement of our patient in standing and sitting in lying position, the gravity change from standing to sitting to lying. So we try to make different movements in different positions, and with the time, or I will explain it right now, we find out where are the asymmetries, because with different movements we will have the same tension in the same place, and as much often we have the same tension in the same place with different movement, this means that this area is more affected than other ones, because normally the tension of the body which increase the muscle tone or produce the pathology, is very far away from the point that the patient comes to you, say maybe, I have a pain here in the neck, but maybe the tension or asymmetry is in his leg, which makes a hip rotation, an asymmetry in the spine, and then he has an overload of this muscle, because instead of walking like that, obviously you want to go straight, and then trying to hold his head in the right position, then he has an overload here. And then, oh, you have a contraction. I have to treat your muscle, and they give you massage or stretching or what else. But as soon as you don't change the information which is putting him in this position, you can make what you want. The pain comes again, again, and again. So let's use the mobility or the movement of our patient and his magic finger, which one he wants to show you where he feels the tension. And after many years, we have found out which areas we have to treat when the patient put his finger in one specific area, but not because not ever where the patient feels the tension has a direct relationship with the area which is affected. And this is something that I explained in my courses, how we have found it out and how is the reasoning. For this, we need a lot more information about fascia and how it works, but this short time, it's impossible to explain, but just hold it in your mind, how it's constructed, all these quadrants that they have to slide, and there's an increase of tension in one point can increase a lot of tension in another part. There's where the patient feels the pain, but the tension comes normally from far away. So the system in using the movements of the patient in one specific order, there are 9 specific positions or movements that the patient has to do. In less than 8 minutes, we are through them, and we know exactly how to start and which direction we have to treat and everything. And this we manage it with this. Once you understand that the alteration of the proprioception comes from the superficial, that the movement of the different quadrants have a direct influence of the proprioception, we have to find out which are the areas which are affected and in which order we have to treat. Because if we have some tension, which gives the tension to right, release here, it goes in this direction. But if we release here, it releases in this direction. So depending where the tension comes from, we have to make it in one or other direction, our strikes and in our order of treatments. It's like a tree. We can put cables everywhere and try to put it straight. No, we have to start from the lower part. When the lower part is straight, then we can go a little bit higher, higher, and higher. Because if we try to correct the position of a tree, pulling from the highest part, we don't are able to put the tree straight if it's not straight on the lower part. So our truck has to be legs, lower limbs, the trunk, and then the upper limbs, the arms, because the legs are not straight, the trunk is not straight, the arms are not straight. Then the fascia or the connective tissue in the front is more stronger than in the backside. Obviously, all the patients or all the people going more in front flexion than an extension. This is why the tissues in the front side are more stronger and get more shorter earlier than in the backside. So we have to release the tension from the front side and from the lowest part. Then we can go to the trunk, and then we can go to the upper limbs. And all during the assessment that we do, the 9 different movements of our patient and the tension that the people shows you with his finger will be put on this crosses. And the cross is front, rear, right, and left. So we have all the points that the patient has. And to know in which order we have to treat, well, the lowest one is the first. If we have 2 on the same level, the front is more important than the back side. And then we have to release one point to another and release all. This don't mean that we have to treat all, because maybe we have 5 points that the patient says he feels tension, 2 in the leg, 2 in the trunk, and 2 in the arms. Well, these are 6. But imagine that we treat the first point. We check after 2 minutes, is it still there? It disappear? Okay, we go to point number 2, but first we test if it's still there, not treat it directly. And if we test and it's not there, then we go to point 3. If it's not there, to point 4. And maybe the point 5 is still there. Okay, then we treat the point 5, and the last point maybe also disappears. So from 6 point, maybe you only treat 2 points. So this system allows you to treat just the things which are important and not the accessory or the compensation of the patient. Because not everything that hurts or gives pain has to be treated, because maybe it's an adaptation. If we change the adaptation, we create a new adaptation, and then we can go round and round, and we heal some part, and then comes the pain in another part, and then another part, and then we never end with our patient. So this systems allows you to be very correct. It's replicable. Normally, just ever, the result of one therapist is the same of the other one. With other systems, no, I think I have to treat this and this and this, and the problem is here. The other say, no, the problem is more here, or we have to focus more on potential exercise. No, we have to stretch more. No. But with this system, you exactly know how to release everything which increase your pathology, everything which has caused your pathology, and at the end, when you remove all this, you know exactly that the damage is just there in this point, and nothing else is increasing or causing the pain there. Then you can focus on the pathology of your patient. So this makes it very easy to understand the body, to make the things right in the right order, and just to treat the areas which are very necessary to be treated. And at the end, you know that the pathology is just there at this point, or has disappeared, because sometimes someone comes with a neck pain. I treat his leg and his abdominal area, and the neck pain has gone. So I don't need to treat his neck. It's gone. It's just an adaptation because he's in the wrong position. I release the position. He is straight. He don't have to contract. No pain. Free movement. So don't treat the things that you don't need. This is also something very important. So to summarize everything, we have a suit on, which is formed by quadrants, because all the nerve receptors are in the superficial, because on the superficial is where we are mostly deforming our body. So it makes sense that all the receptors are there. We have also the skin tension lines, which increase the sensibility of the deformation of the superficial. But to realize that we can move, we need the sliding of the body, and these quadrants allow to slide the body, holding everything in the position, but allowing the mobility. So we have a very unelastic skin, but a very mobility superficial, which has a direct inflation of the proprioception system, which we need to have a right position, a right movement, a right biomechanical, which is important to have a healthy life. So I hope you understand what I tried to transmit to you, that you like it.